Hello, this is Dr. David Green, CEO of the Ohio Pain Network. Today's topic is the basics of platelet-rich plasma therapy. Platelet-rich plasma therapy, otherwise known as PRP therapy for short, is a very exciting procedure. It uses one's own growth factors, platelets, and stem cells to regenerate tissue that's damaged. It's been used for a long time in dentistry, urology, ophthalmology, and other fields, but only recently has become very popular due to its success in musculoskeletal medicine. The definition is a volume of plasma that has a platelet count above the baseline of whole blood. Now, regenerative medicine breaks the mold of conventional treatments. When you look at something like cortisone, which has been the gold standard of joint treatment for decades, it works well, but it doesn't regenerate anything. It just provides pain relief, and then it wears off, and you do it again. It's a proverbial Band-Aid, whereas regenerative medicine treatments actually help heal the actual underlying problem and provide pain relief at the same time. There's a lot of indications for PRP, which can include tennis elbow, golfer's elbow, rotator cuff tears and tendonitis, Achilles tendonitis, knee tendonitis, degenerative arthritis of the hip, knee, shoulder, ankle, etc., ligament injuries, and then also some cosmetic concerns such as hair loss, and PRP facelifts have been great as well. Athletes are using PRP like crazy. I mean, there's a whole laundry list of folks like Kobe Bryant, Tiger Woods, Nadal, a lot of NBA players, a lot of the Dodgers. The list really is very long at this point. How is PRP performed? It's actually a very simple procedure when you look at it. About 30 to 60 cc's of blood is collected from the patient, from the arm or whatnot. It's just a simple blood draw. And then that blood is put into tubes and separated in a centrifuge. It spins it around rapidly for about 15 minutes. And then what you end up with is 3 layers, a platelet poor, platelet rich, and a red blood cell layer. This is what's used, the middle layer. Okay, that ends up being about 5 to 10 cc's, and that gets injected into the problem area, either the shoulder, the hip, the knee, what have you. PRP therapy does promote inflammation, which is the first part of healing, so it actually can be more painful for the first 48 hours. You should actually stop anti-inflammatories prior to the treatment so that you don't inhibit that inflammation. Professional sports leagues have not banned the use of PRP therapy. Initially, the World Anti-Doping Association did ban it, but they reversed that based on the fact that there's a lack of any current evidence concerning the use of these methods for purposes of performance enhancement. All right, so there's no issues with pro sports using it or Olympic. What are the outcomes? Well, there have been several studies looking at PRP therapy. There's a couple notable ones. 2013 knee study patient in 22 patients. They showed no change in arthritis and over 80% at 1 year with just one PRP injection. Pain scores were decreased. Functional and clinical scores were increased. They actually looked at serial MRI scans and showed that the arthritis did not change. Basic science studies have showed that PRP treatment may improve healing in many tissues. Studies have also shown that there's at least 7 growth factors in PRP therapy. So you're not talking about just 1 or 2. You're talking about a lot of factors that can help heal damage. There was a study out of South Florida in the Clinical Journal of Sports Medicine also looking at PRP for tennis elbow in about 30 patients. Over 90% of them were able to avoid the need for an operation. All of these folks were at their last resort. They had tried PT, steroid injections, everything, and they were basically looking at an operation for tennis elbow, and all but 2 of them were able to avoid an operation. More studies are needed to prove the effectiveness of PRP treatment and to research the best ways to standardize the preparation. Okay, but all that we've been looking at right now shows that it works well. It's your own blood, okay, so there's no risk there. It's an outpatient procedure. You do see increased pain for about 48 hours due to that inflammation. It may need a series of 2 to 3 injections. We don't know exactly what the best treatment regimen is. It's not covered by insurance right now, so it is an out-of-pocket. The studies available to date show an excellent outcome with slight downside, and the downside is basically it's just an out-of-pocket expense. It may need more than 1 procedure, but the risks are so low with a minor risk of infection. The top non-operative pain management in Ohio is through the Ohio Pain Network. There are several clinics participating, accepting over 50 insurances and providing over 25 different treatment options with the board-certified physicians. Visit us online today at ohiopainnetwork.com and then call us for more information and scheduling at 888-466-9898. I'm Dr. David Green with the Ohio Pain Network. Your pain stops here.